If you're planning to have knee replacement surgery and you've heard this, you definitely can't play any sports anymore because you're going to either ruin the knee replacement all over again, you're going to re-injure yourself, or you're going to get way more knee pain just because you try to play sports again. This is actually one of the biggest lies about knee replacement surgery and recovery in general. So after having a knee replacement, yes, there are things that you want to avoid at certain timelines, and returning to sports, you definitely have to wait a certain period of time in your recovery until you are physically and capable of handling all the demands that comes with the specific sport that you're trying to participate in. It also is going to depend on how well or how good of shape you were in prior to the surgery and how often you were actually participating in that sport before surgery. So big picture wise, if it's been years or decades since you played a recreational sport, so tennis, for example, and you just want to get back into it because now you have no knee pain, yeah, you can definitely work your way up. You continue physical therapy, you work on maybe some new strength and conditioning with a trainer to make sure that you build up enough strength and stability and endurance to get slowly back into tennis. That is definitely doable, and it's very common actually with a lot of people who had a knee replacement, because after the surgery and after they complete a couple months or a few months of physical therapy, pain is significantly better and overall function is going to be better, because before having the knee surgery, pain is going to be very inhibiting. It's going to limit how much physical activity in general you're doing, even if it's like the day-to-day activity. So going up and down stairs, doing lower squats or bending of the knees, that's going to feel so much better and easier after the knee replacement. So a lot of people will want to get back into some kind of sporting activity that they loved and enjoyed, but maybe they've heard what we talked about before, where you have to avoid sports and high impact activities at all costs to preserve that new knee joint. But that's definitely not true. If you build it up appropriately with your strength, your range of motion, your balance, and your overall mobility, that's definitely something that you can return to at some point. Now, for the individuals who were playing the sports even right up to the surgery, and now their pain and symptoms are much better, they're going to have a quicker transition to getting back into their sport, because they're going to have a higher threshold of strength and overall physical fitness once they finish their initial physical therapy after the surgery. But one of the things that you also want to consider when you're returning to sport is what sport specifically are you trying to return to, right? So all the lower impact are definitely more feasible and just easier to return to. So if you're a swimmer, obviously you can get back to swimming much sooner. If you did cycling, that's going to be a good transition, because you're going to be using the bike in physical therapy in the clinic already. So that's going to be a nice smooth transition to road cycling, or even like just cycling in a class. Now, when it comes to the higher impact, so anything where there's maybe some jogging, some running, some sprinting, especially any cutting or single leg jumps or hopping. So this would be your volleyball, your tennis, your pickleball, basketball. So where you're doing some kind of running and some kind of jumps, those just need much longer of a period of strength and conditioning and specific physical therapy to make sure that you don't have certain strength deficits or range of motion limitations that are preventing you from moving safely for the demands of each individual sport. Now, I've personally had many patients who return to tennis and pickleball, so those racket sports, and are able to move around the court just fine. I've even had a couple volleyball and basketball players who just either they shoot around with their family, or maybe they do like some pickup games once or twice a week, and they're able to do what they need to do. Maybe they're not going full out as they used to in terms of high intensity with the competitive sports, but they're at least able to do the basic functional movements and are able to participate in some sort of fashion. So the main takeaway that you need to understand is the higher the impact, so the more jumping, cutting, landing on one leg, the more potential situations that you have that require those movements and positions, that's going to take a longer process of going through physical therapy and strength and conditioning to make sure that you stay pain free, to make sure you're physically capable of doing those movements, but also to take stress off of the knee joint itself. So the more strength you have in your calves, your glutes, your quads and hamstrings, and even your core, that's going to make sure that your knee joint is stable, and also the load and the impact is getting absorbed by the muscle and less on the joint. So if you've heard that you can't return to sports after having a total knee replacement, that's definitely a lie. You just have to make sure that you do the right things to return safely. But from my experience, I've had patients who are able to successfully do that with different sports. You just have to make sure that you do your due diligence and make sure that you do all the homework and all the preparation needed before you get into your sport too soon. But if you do it the right way, then you definitely can return back to sports.